Hello, my name is Dana Guggenheim, and the project that I have been working on this summer is called Investigating the Unintended Impacts of COVID-19 Isolation and Uncertainty in Long-Term Care Settings. So for some background, skilled nursing facilities, referred to as SNFs, care for about 1.5 million residents nationwide. The elderly skewed age distribution of residents and the pre-existing health conditions that many of these residents have make them a high-risk COVID-19 population. This is a population that has seen high case fatality rates, and below is the recent CMS data of resident cases and deaths as of July 12th. The congregate living spaces that are shared in SNFs are also very conducive to rapid transmission of COVID-19, and as a result, strict infection control procedures, including isolation, have been put in place. As a result of this, there has been increasing concern about cognitive and physical decline in residents, and this has been observed by many health professionals within the Duke Health system. So our objectives are to understand the impact of COVID-19 on SNF resident functioning and on staff mental health, to analyze qualitative and eventually quantitative data collected from SNFs, and to improve care models and staff education focused on addressing changes in residents' cognitive and motor functioning. This project is essentially split into two phases in the short term, which are conducting and analyzing interviews with SNF staff and residents, or proxies if needed, and this would be the case if a resident is not cognitively able to provide an interview. We plan to recruit participants from within the Duke Hope Collaborative, which is a formal collaboration of many different SNFs across multiple nearby counties that is affiliated with Duke Health. We will then be applying for an NIA supplement grant to the existing Duke Roybal grant in order to continue addressing the cognitive, behavioral, and physical effects of isolation on SNF residents. The interview population, as I stated, is divided into providers, which may include nurse practitioners, registered nurses, CNAs, physical and occupational therapists, physicians, and speech-language pathologists, among other positions. The other sample will be comprised of SNF residents or proxies if a resident is not cognitively able to provide an interview. Each population will have different perspectives on the impacts of isolation, but we're looking to get a better understanding of changes in things such as mobility, mood, self-sufficiency, in addition to new policies and care methods such as telemedicine. We're also concerned about the mental health of staff as they are working a very high-risk and high-stress job during this time. So what have facilities done to address this? COVID-mandated isolation disrupts many aspects of the lives of both residents and staff, which is shown here in Figure 3. This includes connections to outdoor activities, faith, socializing with family and community members, engaging in tasks independently, and feeling overall secure. In order to enhance communication between different SNFs within the Hope Collaborative, we're aiming to design an ECHO model, which is based on staff education and training in order to share best practices of care. The goal will be to integrate providers into the currently held sessions rather than just having administrators present, and to focus on addressing the impacts of isolation that are being observed. Figure 4 depicts a graph of Hope Collaborative attendance in recent months during the pandemic, which has increased since last year's numbers, likely due to the online format rather than in person. By conducting these qualitative interviews and analyzing this preliminary data, we will be able to recommend best practices of care to SNFs in the collaborative in response to the firsthand experiences that we hear. Figure 5, which is from the Senate Committee on Aging, shows a correlation between nursing home ratings and percentage of facilities with COVID-19 cases and deaths. The lowest percentages of deaths and case rates were seen in the 5-star rated SNFs. Therefore, we hope to use this qualitative data that we obtain through interviews to improve care. So our next steps are to complete these interviews following IRB approval. So we're currently in this process, and we split the IRB proposals into two, one specifically to providers and one to residents. So we've gotten some feedback on the provider proposal, and we'll be submitting the resident proposal by the end of July. Following that, we will recruit SNFs in the Duke Hope Collaborative and recruit residents as well, and then analyze this preliminary interview data by extracting themes from the interviews, and then use this to refocus the specific aims of the NIA supplement to the Duke-Margolis Center towards cognitive effects, motor decline, and socialization. We're also hoping to obtain mean dataset data from nursing homes in order to quantify this impact on COVID-19 residents. So the MDS includes both behavioral and physical measures of patient well-being within SNFs. So, in conclusion, we have seen that the impacts of COVID mandated isolation procedures on both residents and caregivers must be addressed. Care quality improvements should and can also be applied to other future epidemics and outbreaks aside from COVID-19. So, we want to be able to use this time in order to improve care in the long run, not just during the COVID-19 pandemic. Research in SNFs is gaining a lot of attention and relevance during this time and is a growing area to look into, and I look forward to continuing this work beyond the internship program and into the fall as a Duke-Margolis scholar. This project would not be possible without the additional help of Dr. Heidi White, Dr. Kathleen Cullen-Emmerich, Emily Hecker, Dr. Eleanor McConnell, and Dr. Janet Becker. They have advised the study team through this project and through the RB proposal, and I thank them for that. And internal funding from the Population Health Management Office has also been utilized in order to compensate participants. And another thank you to my mentor, Dr. Jev Sangbai, and to Heather Jacobson, who has also been like a secondary mentor to me throughout this entire process. Thank you for listening.